Welcome back. This is the second video of the 13th class for social psychological perspectives on health. So in the first video, I talked about the basic structure of groups for health program. And then here, I will actually talk about the sort of evidence that they get from this program. So proof of concept evaluation. Is groups for health effective? How or why is it effective? So this is basically the question that the authors of the textbook try to answer. So the groups for health program would be effective if it improves health and well-being, if it strengthens a sense of social identification, if it helps people realize the power of their social identities through schooling and scoping, and then it would be effective if it helps people develop the skills to maintain, strengthen, and create new social identities through sourcing and scaffolding, and maybe through sustaining. And then if it is effective, if it is feasible and acceptable and relevant to participants and facilitators. So they look at retention rates and whether participants and facilitators enjoy the program. Okay. So this is what they have done. They endorsed the program to university students, and then they measured the effectiveness of the program at 3 time points. First one is time 1 before the commencement of groups for health. And the second time is right after the final module of groups for health, approximately 2 months after the first module. Okay, and time 3 is a 6 month follow-up. So after the end of the 5th module, they waited for 6 months and then asked those participants to indicate their well-being and so on. Okay. And this is a result. Okay, that's quick. So this is a comparison between time 1 and time 2. So the blue bars indicate their depression, anxiety, stress before the commencement of group for health. And orange bars indicate their well-being depression. So the indicate the measures of well-being right after the final module. So it's 2 months after the first module. And as you can see, after 2 months, participants show decrease in the means of depression levels, and also decrease in the means of anxiety level, and also the decrease in the means of stress level. So overall, if they went through the program, they improved anxiety, depression, and stress levels. And then this is also the comparison between the time 1 and the time 2. So before the commencement of group for health, people had this level of loneliness, life satisfaction, self-esteem, and then also they were asked to indicate how much they identify with the program, and then with the groups that they are member of. Okay. It's kind of interesting that even at the before the commencement of group for health, people pretty people have already very strong identification with the program. But anyway, as you can see, after 2 months since the beginning of the first module, the levels of loneliness decreased, and then the life satisfaction improved, self-esteem also maybe slightly increased, and then they developed stronger social identification with the groups for health, and also they developed stronger multiple group membership identification with their multiple groups. Okay, so these results really tells that participants improved their well-being after the program. So I think these data indicate that the program was effective. Okay. And this is another figure that compares between group for health group and control group. And then this is a follow-up data. So after the final module, they waited for 6 months and then they asked those participants again to indicate the depression, anxiety, stress, self-esteem, and satisfaction levels. All right. And as you can see, so that more negative the values are, mean that they improved their depression, anxiety, and stress levels after the after the time one. So, okay, maybe let's look at the depression. So 0 means the level of depressive symptoms that they have before the commencement of the groups for health program. And after 6 months, their levels of depressive symptom has been greatly decreased. So meaning that their well-being has been increased. Okay. And then furthermore, the levels of decrease in their depression symptoms among people in the control group is much smaller compared to those in the groups for health group. Okay. So first, it shows that groups for health is effective because after 2 months, people improve their depressive symptoms. And in addition, even after 6 months since the end of the program, the depression symptom is still very good compared to the before, compared to the before the commencement of the program. Okay. Furthermore, groups for health group is more effective than control group. Maybe I think this was cognitive behavior therapy that people went through in an individual therapy session. Okay, and then anxiety, you can see the same pattern. They improve their levels of anxiety significantly after 6 months. And the levels of anxiety is much lower compared to control group as well. Stress, the same pattern you see. And self-esteem, compared to the time before the commencement of the program, people improved self-esteem after 6 months, while in the control group, the self-esteem did not change. And then maybe there is also the difference between the control group and the groups for health. Life satisfaction, it improved after 6 months and then it's higher than the control group. Actually, among the people in the control group, they decreased the level of self-satisfaction after 6 months. Okay, so overall, these results indicate that group for health program is effective and also it's more effective than the control group. Okay. And this shows how identification with the groups for health and then identification with the multiple groups that they are member of are related to different measures of well-being. So for depression, if they strengthen the identification with groups for health group, G4H group, then it's significantly, sorry, let me say again. If participants strengthened the identification with G4H, then such increase in their identification was negatively related to depression, meaning that if they strengthen the identification, then they would have lower depression. For multiple group membership, the identification with multiple groups was not the changes in identification with multiple groups was not related to depression. Well, the stronger they have identification with multiple groups, the smaller they have depression symptoms, but this effect was not, this association was not significant. Anxiety, yes, if they strengthen identification with G4H and with multiple groups, then their anxiety levels was lower. Stress, yes, if they strengthen the identification with G4H and multiple groups, then the levels of stress they experience would be smaller. Social anxiety didn't change. Social anxiety is like how much fear they feel when they communicate with other people. And I think maybe the reason this measure was not associated with changes in identification was that this measure is more like general measure that indicate how much fear or anxiety they feel when they interact with others. But social identity approach really argues that what matters for people's loneliness, life satisfaction, and depression is that how much interactions and communication they have within a group. Or in other words, how many groups that they belong so that they can have such intra-group communication, right? So I think the social anxiety wasn't really conceptually related to what social identity approach offers. Life satisfaction, identification with changes in identification with G4H was not related, but through identifying with G4H and then through identifying with G4H, people can strengthen their identification with multiple groups. And then such changes in identification with multiple groups improved life satisfaction. Self-esteem didn't change. Maybe this measure was more stable and then maybe not very sensitive to the changes in identification with groups. But loneliness, yes, by strengthening identification with G4H and the other multiple groups, the levels of loneliness decreased. So overall, I think these data again indicate that group for health help people to feel less lonely and more happy. Okay. And also acceptability and feasibility. Many people completed the program and many people enjoyed and learned from the program and perceived it useful for their future. And also facilitators also evaluated the program highly and showed the intention to recommend the program to those who suffered from the loneliness. And then facilitators reasonably adhered to the manual higher than the midpoint. So yes, groups for health program is effective and it can be people can enjoy the program and it can be administered by facilitators. So I think in a short sense, you can say that groups for health program is useful. Okay, actually, this is it for the final chapter. In conclusion, the top 10 social identity tips for better health. These tips should be already familiar with you after learning all the contents in the course. If you feel socially isolated, try to join a group. If you can join, you should join more groups, not just a group, but join more groups. Try to hold on to positive group memberships, especially if you are going through a challenging time. If you are going through changes in your life or transitions, if you are going through life transitions, try to hold on to positive group memberships. If you have some hardships, try to hold on to positive group memberships. If you lose memberships in an important group, seek out a new one. It would be much better if you seek out a new one while you are still in an important group. But it's not too late to seek out a new one after you lose the group. Invest in groups that are important to you and in groups by which you are valued. So I think it's important to invest in groups that you feel important, but also it's important to invest in groups that others think you are important. Okay. Be wary of groups that make unhealthy choices. So joining any groups doesn't help your health much, but join groups that have positive or healthy ideas. Okay. Get support from your groups, but also give support to others in your groups. So as I said, just getting benefits from groups may not be a good idea. You may want to contribute to groups as well so that you can maintain your group memberships, and then you can also help members of your group. Recognize that it can sometimes be healthy to try to leave disadvantaged and stigmatized groups, whereas at other times it can also be healthy to stay. So as I said, for example, homeless people, it's not always a good idea to categorize themselves as a homeless, and then such categorization would have negative impacts on their health. But remember what I talked about Black people, when they leave their Black community, their well-being actually decrease. So it's really balance and the timing, I guess, whether you want to leave or whether you want to stay. So I think here the tips really tells that it's important to recognize there will be both good and bad of leaving and staying in groups. Okay. 9. Challenge the stigma and disadvantage that produce health equality. So I guess this is something that each individual can do. This is not something each individual can do, but more like as a society, as a whole society, as a society as a whole, we shouldn't accept inequality, but we should always challenge the inequality so that everyone can join the groups that make them healthy. 10. If you experience health problems, seek professional help, ideally from a source with which you identify. So I hope this is already clear to you, but just relying on social identity approach is not perfect. Of course, you need medication, and then you may need some help from doctors, but you are more likely to adhere their suggestions and treatment if you can look for help from your in-group members, right? And then democratizing intervention. So as you see, Group for Health is accessible and easy to use. So, but still, a lot of people do not have knowledge about how groups are important for health. And I hope this class helps to democratize the knowledge of the groups for our health. I mean, knowledge about the power of groups. Sorry. I hope this class helps to democratize the knowledge about the power that groups have for our health. Okay. This chapter and indeed this book as a whole should be understood as an invitation for you to contribute to that effort so that you not only read about social cures, but also help to unlock them yourself. And I hope that not only the textbook, but also the discourse help you to unlock the power of groups for health, and then you can help others to unlock such power. Okay, this concludes the course of social psychological perspectives on health. I hope everyone enjoyed the class, and I hope the content of the class was helpful for your health and for your future. Thank you very much.